walking around. So if you hear like a jingle jangly little chain, that's him. He's about to jump in his chair and he's going to make a lot of noise. So here we go. We're going to talk about CNS stimulants. Generally, CNS stimulants are going to be to elevate the mood, create euphoria, alert the patient. They're going to decrease appetite, increase task performance, decrease fatigue and drowsiness. Prolonged wakefulness is also a goal. It'll relax bronchial smooth muscle, and there will also be the dilation of pulmonary arteries, as well as increase respiration. CNS stimulants are contraindicated in those patients who have cardiac abnormalities, who have marked anxiety or marked agitation, who have hypertension, glaucoma, and who have used MAOIs within the past 14 days. For CNS stimulants in general, you need to assess the growth patterns of children. When we get over here to the ADHD drugs, many children will take that's my dog making all that noise. Many children would have drug holidays when taking these drugs because they do stunt growth. So we need to assess growth in these patients. And you also need to know other meds that the patient is on, as well as over-the-counter drugs, herbals, and essential oils. So there's 4 different categories. We have ADHD drugs, narcolepsy drugs, anorexics, and anti-migraine. So we're just going to start over here. ADHD drugs in general, the adverse effects are going to be an increase in heart rate and an increase in blood pressure. They can cause angina, which is chest pain, anxiety and insomnia, headache, tremor, blurred vision. They will also increase the metabolic rate of the patient. They can cause GI distress and dry mouth. So we have 4 different drugs right here. We have amphetamine, methylphenidate, let's see if we can say this, atomoxetine, maybe, and lisdexamfetamine. So tamine. This one is dexedrine or Adderall. This one is Ritalin, and this is Strattera, and this is Vyvanse. So there's nothing specifically that we need to know about amphetamine. I mean, it is an ADHD drug, so these are some of the adverse effects that can cause that it can cause. Methamphetamine can also be used for narcolepsy. Hope I said that. Methylphenidate. I don't know how to say these drugs, but this is how you spell it. Atomoxetine is children over 6 can use this as Strattera. It's a non-stimulant and there is a low abuse potential. It is a norepinephrine reuptake inhibitor, and there is an FDA warning. It's like a black box warning because it can cause suicidal thinking or suicidal behaviors. Vyvanse is the prodrug for dextromethorphan. I cannot say these drugs, but it is a prodrug for that. See? That's how you say it. That's how you spell it. For narcolepsy, the goal of therapy is to decrease fatigue and drowsiness and prolong wakefulness. So obviously, a patient who has narcolepsy will have more periods of fatigue, and my dog really wants to go out of the door, but he's not going to because I'm busy. There are 2 drugs for narcolepsy. Again, this is the drug over here that's also used for ADHD, methylphenidate. See, also used for ADHD. That's Ritalin. And then modafinil. This one is Provigil. There's a low abuse potential, and a lot of people who have shift work sleep disorder, so if they work in a plant or if they are nurses and they're working the night shift, this can help them. Anorexics, the goal of this drug is to suppress appetite control centers in the brain. It's going to increase basal metabolic rate and mobilize adipose tissue stores. So there are some adverse effects that can go along with these drugs. So it can increase the blood pressure. It can cause heart palpitations, anxiety and agitation, dizziness and headache. And my dog keeps on hitting the metal door. So sorry about that. Come here, Gus. Come here. I got a treat for you. I think he knows I don't have a treat for him. Come here, Gus. Come here. At least it's getting his attention away from the door. Okay, so there's one drug in particular that we're going to talk about for an anorexic. It's phentermine, and the brand name is Ionamin. So for this drug, you're going to want to take it early in the morning because it will make it hard for the patient to go to sleep. It could cause insomnia. It is a stimulant, so remember that. Phentermine works better with diet and exercise instead of the patient just taking phentermine alone. Diet and exercise are going to help them too. It's contraindicated in those patients who have severe heart disease, hypertension or hyperthyroidism, glaucoma, mental agitation, drug abuse, or patients who use MAOIs. And there are some nursing implications for patients who take phentermine. They need to take fat-soluble vitamin supplements because their body is not absorbing all of the foods or not absorbing all of the nutrients that are in the food. They need to also avoid caffeine, and patients need to wean before stopping this drug completely so they don't get rebound appetite. For anti-migraine medicines, we have 3 right here. They all end in triptan, Triptan. There's naratriptan, rizatriptan, and sumatriptan. So Emerge, Maxalt, and Imitrex. Those are the 3 anti-migraine. The goal for an anti-migraine drug is vasoconstriction to reduce the headache. So there's a lot of blood all up in the head. We want to remove that blood and get rid of that. So they're going to constrict the blood vessels in the brain, let less blood flow up to the brain to help relieve the symptoms of the migraine. It's important to remember that anti-migraine drugs are abortive therapy. Don't get freaked out about that term. This stops the migraine once it's already started. So they can't take like their magic anti-migraine pill. Oh, I'm going to take it today. I'll probably have a migraine. You don't do that. You have to take it once you already have the migraine. So I'm going to take it 2 o'clock. I get a migraine. I can take this as soon as I get the migraine, and it'll help lessen the adverse effects of the migraine. So there are some adverse effects of anti-migraine drugs. Patients can experience tingling, flushing. They can have a congested feeling in their head, and they can also get rebound headaches. So those are the 4 different categories of stimulants. We have the ADHD drugs, narcolepsy, anorexins, and anti-migraine drugs. Remember, for all of these drugs, they can relax the bronchial smooth muscle, and they dilate pulmonary arteries. So good stuff there. And it is contraindicated in patients who have cardiac abnormalities, hypertension, anxiety or agitation, glaucoma, and MAOI use within 14 days. If they do use those MAOIs and also take stimulants, they can have a hypertensive crisis. So that's just something you need to ask your patient about. Remember, for children who are on ADHD, typically during the summer, the doctor will suggest that they take a drug holiday so that they can have a growth spurt, because these drugs will stunt growth in children, and I guess adults too, but we're really worried about the children. So those are all the ones we have for CNS stimulants. I'll put it up to the screen so that hopefully you can see it. You can see how to spell the words, because Lord knows I do not know how to pronounce them. Okay, there we go.